All right, we have Manny Mclovin on the prostate and the colon.
Hello, ladies and gentlemen. Again, this is a special edition of Manny Mclovin. And one thing you should all know is something about your prostate and your colon, just to brief you up and get you intact and what's going on. A friend of mine recently had a problem with his urinary flow, and it was getting slowed down and slowed down. He had a blood test by his urinologist, and there was no cancer. So he took Avodart, Flomax, and began to help in the beginning, but then after a while that enlarged prostate started getting worse and worse and worse. So you have to empty out your bladder, your urine, in a way that just everything comes out, otherwise you hold it in and you're acceptable to like germs and sicknesses. Anything can happen if you hold urine inside your bladder. So what happened with this particular individual is that they finally went to the hospital after this patient could not urinate, he was dripping anymore, and he had to have this operation and get this trimming of his prostate so his tract would be clear from his bladder so it could urinate again and get everything out of his bladder, everything would be clean. No more Avodart, no more of the other medication I was telling you before about. And it seems to work out very good right now. I'm saying, when is the last time you people were checked out? I'm saying if you're 40 to 50 years old, there's like a 40% chance of an enlarged prostate, and from 50 to 60 is like a 60%, 60-something percent, 50 to 60 of enlarged prostates. Now, if you feel a change in your urinary symptoms, if they're slowing down, or if you have a little pain, you're getting urinary infections, I would say check out your urologist, and he might say you have an enlarged prostate. So we'll start treating you with Avodart and Flomax. Flomax is supposed to shrink the prostate, which it never did for my friend. And the other one is Flomax, supposed to be a relaxant for your prostate, so you can bypass the enlarged prostate and make the urine flow better, which did work for him for a while, but you can't fight City Hall. So eventually he had to go in the doctor, and he's trimmed out with the laser some of his prostate. Now he's going actually better to the urinate every day. His bladder's being cleaned out. There's no more infections. He feels 100% better. I'm just warning you, America, and the people that are watching, get yourself checked out. The time is running out. You never know. Always get a cancer, also a blood test for your prostate. Prostate and your colon. There's a big problem with colon cancer also, ladies and gentlemen. The colon comes from inside the bottom of your stomach and roams right through where you have your bowel movements. This could be polyps, it could be inside your stomach, lower intestines, you could have cancer. These are all good due to checks, and to check and see if there's any blood ever when you move your bowels, make a bowel movement. If there's any bloods, it might be hemorrhoids. Sometimes they're not cancerous. You just get a little tube of whatever ointment you want to use from a doctor, or the one that's out
Preparation H.
Preparation H, thank you, John. And this might just soothe them temporarily. Sometimes they even shrink them. But they could be very annoying, especially when you're sitting down all day. Hemorrhoids can be itchy, and it's one thing you should take care of.
McLovin, if anybody used Bengay on their colon, what would happen?
Bengay, might burn them right off. That might be a good idea. It'd be painful, but you might knock the doctors out of business. Did you hear what John said? Bengay on hemorrhoids? That's very, how can you even say that? I wouldn't do it. I'd be running around a block for five days and saying, "Mom, help me, give me some water, I need water." Even the Bengay, very, very strong. You're in the background, the champ, but it's really not a joke. So you people out of 40s, 50s, and 60s, it's time to get yourself checked out with your colon. You can have a colonoscopy where they go up and see if the colon has polyps in it, and outside if the hemorrhoids are cancerous, and also check your prostate out. Of course, the urine has to be emptied out of the bladder, and Avodart and Flomax don't work. It's time to get a little operation, a minor one, so you can clear out the system and feel better 100%. This is Manny Mclovin, hoping that your prostate and your colon get along better, and see your doctor as soon as possible. Thank you.